Yeah, right, good. All right, on set with me now is head of urology at Cornwall Regional Hospital, Dr. Roy McGregor, who specializes in and is the only doctor in the English-speaking Caribbean to do laparoscopic radical prostatectomy. Is that?
That's right, prostate cancer surgery.
As an option for persons who have prostate cancer. Morning, sir. Welcome
Morning.
to Smile Jamaica.
Morning.
Great to meet you. The only one.
Well, at the moment,
Yeah.
but
I said radical because it is radical.
it is radical. It's you remove. This is really for patients who have localized prostate cancer before it's spread.
In other words, you have to catch it early for this to work.
Exactly, and that's why we need to screen.
Yeah.
And I just need to make a quick plug because we are doing, the Jamaica Cancer Society is doing a screening tomorrow at the St. James Parish Church, and we're going to screen men free of charge for prostate cancer.
Okay.
Last year we did about 500
Brilliant.
patients.
All right, so tell me, how are you different? Because it says an invasive surgery, which...
Okay, so basically what laparoscopic surgery is...
Well, sorry to jump in. Tell me what would obtain before you get there. So if I don't do what you were doing, what would normally happen?
Okay, well, if you have localized prostate cancer and you have a life expectancy of greater than 10 years, then you're going to try and cure it, and you could either have radiotherapy or surgery. And if you're going to have surgery, the standard of care at the moment is open surgery, where you make a cut from below the belly button down to the root of the penis, or just above there, and you go in and you take out the whole prostate.
Right.
With the laparoscopic technique, you make 5 1-centimeter incisions.
Which is what we're looking at on screen there?
Absolutely. So you make 5 1-centimeter incisions. You put a little plastic portholes into the incisions, and then you blow the belly up with carbon dioxide. And you put a camera through one of the portholes, which magnifies the image onto a TV screen. And I place the instruments down the portholes and do the surgery
Watching
like
the
that
TV
while
screen.
watching the TV screen. It's a bit like video games.
Right.
Yeah.
I like what you say. It's like video games. For some reason, I don't think it's like video games, but I understand the analogy. Okay, and then that's it?
Well, so the advantages are, obviously, you don't have a big incision, so
Right.
there's much less pain.
Right.
Because when the trocars go in, they don't cut through the tissue. It has a point, and it stretches the muscle around the
Right.
trocar, which goes in. So those are little portholes.
Could you take down that picture, please?
And then so you can see on the image there the
Right.
little trocar and the instruments going down. And what we do is we remove all the lymph nodes in the pelvis that drain from the prostate. And with the technique that I do, we get 94% of the lymph nodes, which is, when you do the open technique, on a whole, they tend to get about 55%. And the more lymph nodes you get, the more likely you are to cure the cancer. But the main benefit is you only lose about 150 mils of blood, as opposed to close to a liter of blood.
Right.
So obviously you're going to feel a lot more energetic.
Yeah.
I don't know if a liter is quite a lot.
Come on.
And also the vision is just far superior. So you can see exactly what you're doing. The camera's only a few inches away from the site of the operation.
And you're looking at it on the
And
screen.
you're looking at it. So I have patients who go home the next day.
And
So
that's it? There's no
they
aftercare?
they go home, they have a catheter in.
Right.
And then at 2 weeks, I do a test to make sure everything's healed, and then we take the catheter out. And about 94% of people are dry at 6 months. And if you spare the nerves, if you catch it early, and this is another reason why you need to catch this early, because if you catch it early, you can spare the nerves, and 85% of people, if you spare both sides, will get normal erections afterwards. They may need a little front-end lifter, like Cialis or Viagra or one of these drugs.
They may need.
They may need, yeah. Yeah.
I like that. You've done 109 of these.
Yeah.
So you're an expert at this. Where did you get this expertise?
Well, I did a fellowship in Australia, and started learning at that point. And I was lucky enough to meet Professor Eden from London, and he did the first radical prostatectomy laparoscopically in England in 2000. Mm-hmm. And he's done, must be like 4,000 cases.
You did yours, the first one was what, 2011?
2011, no, yeah, 11. So I met him in Australia, and I said, look, would you mind coming to Jamaica and having a few red stripes and teaching me, how to really, hone my skill on this? And he said yes, and he came out sort of 3 times a year, and we would book, sort of 5, 6 patients each time. And when he thought I had reached a level that I could get rid of my training wheels,
right,
he sort of said, okay, it's time for you to do it on your own. And here we are now.
I suspect the cost could be prohibitive.
Well, at Cornwall Regional, we on a whole don't charge.
You don't charge?
No. I've managed to, some of the times I subsidize the cases myself. Wow. Other times I've managed to get donations from charities, and the government has helped. From with certain cases, and what I do is instruments and stuff that I use in the private, I will donate to the public.
Okay.
And so we've managed to keep the costs right down. Some patients, will have to make up a gap, from time to time.
What would the cost be without the help that you're getting? What would the cost be?
If you were to have it privately or something, it's about $15,000 US.
Which is what, about 2 million, couple, yeah?
I think it's about one point something.
Yeah.
But that's excluding the hospital.
Okay.
Yeah.
That would be just your fee.
And so it's a couple hundred thousand more than the open procedure.
Yeah. Oh.
Yeah.
You still have 109, but the key here is if you don't catch it early, you can't do this, can you?
That's right. So this is where the whole thing about screening is important. Because if you catch it early, then, if the cancer's deep inside the prostate, you can then spare the nerves. You can get a good length of the urethra, which correlates with continence, and cure the cancer. And that's called a trifecta, which is basically, cancer cured, patients fine. And functional.
And fine. So you do the surgery, it's successful, and you're good to go after that. It's not like you win just live for 2 weeks or 5 years or whatever. You're cured.
No, that is
cured.
It. You're cured. After 6 months, most people, 94%, have their continence back. And if we've spared the nerves, 85% of people will get their erectile function back.
Fantastic.
Yeah.
Excellent, sir. Good job. Great to meet you again, sir.
Thank you.
You're a Campion College man, are you?
Campion College, yes.
I won't hold it against you. Good to meet you, sir. All right. And Dr. Roy McGregor, Head of Urology at Cornwall Regional Hospital. 10 minutes to your health. We'll do it again next Thursday.